I think the most important thing when talking about gluten sensitivities is that there is something called celiac disease, where your body really cannot process gluten. And that's when a blood test can tell you whether or not you fall in that category. And if you do, then it's going to be important to avoid all wheat, barley, and that's something that a dietitian can help you with, because sometimes it's not an obvious source. It's not a piece of bread. Sometimes it's an additive, like in a salad dressing or a sauce. And so it's good to have someone to walk through that and help you with that. Unfortunately, when we talk about salt to manage blood pressure and heart disease, a lot of people say to me, well, I don't use the salt shaker, I threw it out, I don't cook with salt. And while that is a huge victory, I think sometimes we forget how much sodium is in processed foods on the grocery store shelves, and we forget how much sodium is in our restaurant foods. So it's really important to try to cook things as much as we can at home to avoid those restaurant foods and to stay in control of our food source. So looking for items that say reduce sodium or lower sodium is a good place to start. Trying again to do those fresh fruits and vegetables. It sounds repetitive, but it's good for everyone because those foods don't have salt added. You know, we want to try to limit things out of a can, choosing frozen or fresh most often. With diabetes, I see a lot of people that are very fearful that all of a sudden they can't eat most of the foods and beverages that they really love. And so what we try to work with is establishing what a carbohydrate is, which foods contain carbohydrates, and then finding a healthy level. For women, that tends to be 2 to 3 servings of carbohydrate per meal. For men, that tends to be 3 to 4 servings per meal. And so we talk about looking at your carbohydrates as if you're on a budget and spending those carbohydrates however you choose so that it is something that's maintainable for you, but then also staying within that budget, not going over, so that your body is able to utilize those carbohydrates and to keep you safe from high blood sugars.